Today we're going to review the proper technique for nasopharyngeal swabbing for COVID-19 infection. We will also identify a couple potential difficulties you may have when swabbing a patient. Prior to performing the nasopharyngeal swab, ensure that the patient's mask is still on and covering their mouth, as this will protect you from any inadvertent coughing or sneezing during the procedure. To estimate the length of insertion to the nasopharynx, simply measure from the nasal ala to the ear canal. It's about 7 to 8 centimeters back from the nasal opening. The insertion in the nose is straight back, parallel to the nasal floor. There is a tendency to insert the swab straight up, or even at an angle. When doing this, you're aiming towards the roof of the nose or structures other than the nasopharynx. The key is actually hitting the nasopharynx, which is straight back in the nose, parallel to the nasal floor. To perform the nasopharyngeal swab, the swab is inserted, advanced straight back towards the nasopharynx, approximately 7 to 8 centimeters. It's twisted back and forth for about 3 to 5 seconds and removed. The same procedure on the other side, moving straight back 7 to 8 centimeters until you hit resistance, which represents the nasopharynx. A gentle twist for 3 to 5 seconds and the swab is removed. The swab is then placed inside the transport media, broken off at the natural cleavage plane of the swab. The final step, fastening the cap on the transport media test tube to ensure no spillage during transportation. The tube is then sent for the lab to be tested. One of the problems you may experience during testing is a patient that moves their head while the swab is in their nose. The appropriate position for the patient's head during this procedure is a neutral position. If the patient is extended or even flexed, you're going to find it very difficult to reach the nasopharynx, and so the neutral position is key. If a patient moves their head during the procedure, temporarily pause the procedure and correct the head position before continuing. Sometimes this would require fully removing the swab, talking to the patient, and then reinserting on the same side to ensure an adequate test. So to demonstrate, if we're in the nose and as we proceed posteriorly, the patient extends their head, you may need to correct by changing the trajectory of your own hand or simply having the patient correct back into the neutral position. You may also experience a patient who tries to grab your hand and pull the swab out of your nose. If this happens, you need to talk to the patient and explain that you have to try again on that same side in order to obtain an adequate test. Another problem you may encounter is if you meet resistance prior to reaching the nasopharynx. With these swabs, you may be able to gently extend past the obstruction and reach the nasopharynx. If you cannot, gently remove the swab and make sure you're able to reach the nasopharynx on the other side.